Hi, my name is Taylor Malott. I'm a certified birth doula as well as a paramedic and an IBCLC. I also sit as the co-chair of the Alberta Health Services Doula Committee. In 2021, in collaboration with the Doula Association of Alberta, a group of doulas as well as AHS leadership came together to create a collaborative group, the Alberta Health Services Doula Committee. This group was created to bridge a gap between doulas and healthcare professionals. Within this group, our goal is to educate and share information between healthcare providers and doulas about a doula's role as well as our scope of practice. We thank you for taking the time to watch this presentation. As the slides progress through, there will be doulas from the committee speaking to you and sharing information. A doula is a non-medical support person who provides support prenatally, during your birth, and postnatal. This support can be physical support, emotional support, as well as educational resources. In Alberta, doulas are unregulated. We are hired privately or we volunteer our services. There are many types of doulas. A few examples include birth doulas, postpartum doulas, Indigenous doulas, loss abortion doulas, death doulas, as well as full spectrum doulas. Amongst all doulas, there are 4 underlying tenets of support. They include body autonomy, informed choice, resources and education, as well as consent. Professional doulas agree to work within a scope of practice. The scope of practice is determined by each educational body. Local and provincial associations may also enforce a scope of practice. Doulas are not the same as traditional birth workers or traditional midwives. All doulas practicing within their scope should never provide medical care. Further clarify what that scope of practice looks like, these are a few examples of things that doulas should not do or provide. They should not be providing any sort of medical care or advice. They should not disagree with medical recommendations based on their own perspectives or beliefs. They should not be administering any medication. They should not be making decisions on behalf of their client. They should not be deliberately aiming to harm the patient-healthcare relationship.
My name's Heather Hill, and I'm a certified doula in the Edmonton area. I also am a lactation educator and a childbirth educator. This committee is aware that the majority of the conflict in the birth space is the result of miscommunication between doulas and healthcare providers. This presentation is meant to provide more information so that we can minimize that miscommunication. So a few things to consider when we're thinking about the miscommunication aspect. As doulas, and this committee would recognize that that direction is out of scope. Instead, within the scope of the doula practice would be to say something like, typically that intervention is not encouraged in the guidelines. Health Canada shares that. I would suggest bringing this up with your care provider to see why they're suggesting it and answer any questions that you have about whatever's being presented to you. So in the birth space, you might hear a doula say to their client, would you like 5 minutes alone to discuss this? This conversation between the doula and the client would be to bring up any questions the client might have that they would then want to share with their caregiver. So the practical work of doulas includes a lot of different things. One is resourcing clients, providing comfort measures to clients when they're in their laboring and birthing time, relationship building with their clients, exploring all the options that are relevant to the client in their situation, continuous support during labor, and that includes early labor and in that immediate postpartum, and on-call support throughout their birthing time. So on this slide, you'll see a list of different tools that doulas use and provide to families throughout that journey of labor. The roadmap of labor is a nice little graphic to describe all of the different ways the doulas support families. More specifically, a doula will provide support in terms of position changes, hot and cold therapy, hydrotherapy, counter pressure, double hip squeezes, co-regulation, empathy and compassion, massage, acupressure, movement and rest, nourishment, wisdom and patience, and managing the environment.
Hi, my name is Grace Pasduck. I am an Edmonton doula who specializes in water birth support. There is lots of evidence supporting doulas, and that is continuous support throughout their laboring and birth experience. This is a support that is outside of the birther's family and works within the hospital system or for home births with midwifery care. There is a 39% decrease in risk of cesarean when a professional doula is laboring alongside with families, whether that is at home or in hospitals. There is a 15% increase in the likelihood of a spontaneous vaginal birth if a doula is present alongside these families. More evidence for doulas is that we actually shorten laboring experiences for families by offering different alternatives for coping within labor and birth. When a birth doula is present, we see a 38% decrease in the risk of a low APGAR score for newborns delivered. Whether birthing at home or in hospital, we see a 31% decrease in the risk of being dissatisfied with your labor and birth experience when you have a doula alongside you. An acronym frequently used by birth workers all over the province is the BRAIN acronym. This stands for Benefits, Risks, Alternative, Intuition, and Nothing. And we encourage our clients to use this to help navigate the medical system and accepting or declining interventions. This committee recognizes the importance of doulas being welcomed into the operating room. And as a doula who has supported families in C-sections before, the difference it makes for families is extreme. Doulas are seasoned professionals that are trained to help co-regulate their clients in stressful situations. Many parents have shared that having chosen support present at the time of birth is often the difference between birthing families experiencing trauma versus feeling empowered. Doulas in the operating room looks like emotional support for mother, father, as well as baby, and taking photos and videos of the birth for families so that they have access to those memories. And in the event of a NICU transfer, doulas are able to support the birthing persons and family in knowing that their baby has somebody with them at all times.
My name is Vicky Todd. I'm a certified birth doula and a Lamaze certified childbirth educator working in Lethbridge, Alberta. I am also the South Zone liaison for the Doula Association of Alberta. Collaboration is our goal, working on the same team to support the birthing family, cohesion and courtesy in the birth room, accountability to the birthing family, teamwork for a shared goal, maintaining a peaceful birthing environment, sharing resources and experience, doulas centering the birthing mother and their partners and supports.
The Alberta Health Services Doula Committee strives to connect the care between Alberta Health Services practitioners, birthing families, and birth workers throughout Alberta. Doulas on the committee are elected and appointed and represent the larger doula community as well as the Doula Association of Alberta membership. Together, we strive to facilitate collaboration among doulas, educators, and healthcare professionals so that we can optimize the accessibility of respectful, evidence-informed, and supportive care for families all over.